Welcome to the Friends with Benefits podcast. I'm your host, Aaron Ware, Principal Agent at Aware Benefits. I'm excited to be here with all of you. Hopefully, this podcast helps demystify the world of health insurance and Medicare and bring you some valuable insights from the experts shaping the industry. We're here to help you make informed decisions about your health coverage, build a community around shared knowledge, and ultimately be your trusted friends with benefits when it comes to your healthcare needs. Before we dive in, I want to give a huge shout out to our incredible sponsor for this episode, the National Automobile Museum, which I'm a member, by the way, and memberships are really cheap. Right here in beautiful Reno, Nevada, we're filming in this spectacular location. And if you haven't had a chance to visit, you're missing out on a true gem of automotive history. Thank you again for National Automobile Museum for your support. My guest today is Katie Charleson, the Communications Officer at Nevada HealthLink, Nevada's state-based health insurance marketplace. Katie, why don't you tell me about you?
All right. So my name is Katie Charleson. I oversee marketing communications through Nevada HealthLink or Silver State Health Insurance Exchange. We're the state agency that runs the marketplace known as Nevada HealthLink. I live in Northern Nevada and have for the last 20 years. I'm currently down in Douglas County with my family. I love having a chance to serve the communities that I grew up in, getting out there and connecting people to health insurance. I'm excited to be here today. Thank you for having me and to share more about what the work we do at Nevada HealthLink, what's new this year, and how we're working to make health insurance more accessible for Nevadans.
Great. So just really quick, I'm going to give our audience a little bit of a shallow dive into what the exchange does, Nevada HealthLink does. Basically, Nevada HealthLink acts as the mediator between your tax credits that you're going to get from the federal government, from the IRS, and your health insurance in order to make your health insurance premiums more affordable and sometimes your costs as well, depending on where you fall. It's all going to be income-based. So we take a look at how much income do you make, how much of a tax credit you think you're going to get, and then the exchange takes that money from the IRS, sends it on to the insurance company. So your experience is a much lower premium. One of the things that I wanted to talk with you about, Katie, was as a broker in this community, I do a lot of individual and family plans through the exchange. I help a lot of I don't even want to say lower income, it's lower to middle income, really. People get those tax credits, get those lower costs, and help make sure that they're insured. How does the exchange really view the value of the broker community? Like, what is it that you guys think you gain the most from that?
I think it's huge. I think the broker community is really the reason why we're able to access so many Nevadans. Brokers are responsible for enrolling about 70% of our enrollees, which is a huge number. And that's just the people who actually had claimed their broker. A lot of people go to a broker and they're talking to them and still getting the information. So you guys touch such a huge majority of our audience. And insurance is confusing. It can be really complicated. There's a lot of things, make sure doctors are covered, medications, your service area. There's a lot of factors that go into choosing the correct plan and sitting down with a broker and talking about what you need, what your family needs, what your budget is, what realistically, your deductible, all of those things that you need, they're going to walk you through that process. So it's really invaluable, that service. And it's always free. And these, again, are local Nevadans. So Aaron lives in Reno. You live in Reno, you can sit down and talk to them about what you need, and they're going to help walk you through that process.
Yeah, I think that's a couple of important pieces in there that I see. Number one, with Nevada HealthLink, in order to become contracted or credited to help people enroll in that plan, you have to be a local broker. You have to have a Nevada-based license. You be a telemarketer wherever they house the telemarketers of the world. So I think that's really important. And as a brokerage, as an agency, I always tout that we don't charge our clients any sort of consulting fees, anything like that. And in fact, if you're going to be a Nevada HealthLink broker, you're not allowed to, even if there's some Nevada statutes that would allow some brokers to do that in order to help people through the exchange. You're not allowed to charge that fee. So I think that's really cool. And a little peek behind the curtain. know. But the reality is our commissions, which are paid to us by the insurance companies, our commissions are functionally the same. They always run between $20 and $25 per member per month. And so there's not an incentive for anyone in the broker community really to push towards a particular carrier so much.
And so you guys and all of you guys are certified with Nevada Health Link and the DUI and kind of go through that process and the training. So like you said, it's unbiased information and suggestions, which is just, you really can't beat it to be able to sit down with someone and really talk about all the plans available on the exchange. We have 7 carriers in Reno, Washoe County, 6 or 7. So there's a lot of plans, a lot of plans for option. You have over 100 plans to choose from. It's a lot of information. So really sitting down, talking about it, getting that unbiased information, it's you need to do that if you're enrolling in insurance. And kind of like we were talking about earlier, maybe even if they're not the marketplaces for you, you guys can help point them in different directions as needed.
Well, often people come to us, especially now, like in the summer, in the middle of the year, and they just suddenly decided that they need to get health insurance. And of course, because of the Affordable Care Act and the rules of the Affordable Care Act, we're not able to enroll them in a qualified health plan right now. It's always um, it's always an interesting conversation because I will tell my clients and I'll tell members, I'll go, I do have access to some alternative plans um, that are actually cheaper, but you're going to hate it. And so the reason that I don't, you almost have to beg me to sell you one of those plans because they're not qualified health plans. And so when we meet people this time of the year and they're not able to, we're able to access other community resources or send them to other community resources to help them make sure that they get that coverage. And Nevada Health Link, I know, works somewhat closely with those resources as well. Things like I like Community Health Alliance. They have a really great office on Wells Avenue here. I think they have 2 or 3, but that one's closest to us. So, and it's not some scary back alley chop shop place. It's really freshly painted. It's nice. They have great help there. They have a pharmacy there. And we work with Nevada Hopes. I know that in our rural communities, Gardnerville and Carson City specifically, I think that Ron Wood Foundation does a lot of help for you guys.
Access to Healthcare Network is a good one too. Yeah,
So,
a lot of options. But I think that's just one of my favorite parts about our brokers too, is you're just there to help, no matter what it is. And the exchange plans are fantastic. And they're, like you said, they're qualified health plans. So they're all Affordable Care Act certified. You're going to get your 10 essential health benefits covered. You cannot be denied or charged more for a pre-existing condition. So there's a lot of benefits in rolling through a marketplace plan. But really, I just love that you guys are there for people no matter where they're at in their life or the time of year. If they need to wait for open enrollment, you can, help them get access to that healthcare.
Yeah, for sure. What are the things that I wanted to tout about the exchange, and then you can go ahead and prop me up afterwards, is the communication between the brokers and the exchange. So people get confused often about what system they're dealing with, right? So you can be dealing with the medical system, and that is not the insurance system. That is the medical system. And it all ties together in their mind. You can be dealing with your insurance company, or you could have some sort of challenge with the exchange. Your tax credits aren't coming through, or you disenrolled for whatever reason. And the exchange has set up 2 systems. They have a broker hotline, which is really well run. Their customer service representative is amazing, and I can usually get through within just a couple of minutes. And then they have a ticket system. So a lot of times my conversation with the CSR is, I'm going to need a ticket, right? Because we're going to have to move this up the line, obviously. But I'll give you a great example of just in this past month, I had a woman that had a baby, and she missed the 60-day enrollment by 1 day. It was day 61, right when she
Poor thing just
submitted
had a
her
baby. It's
application.
so foggy right after you have a
Right.
baby.
Yeah.
Yeah.
And I actually was able to call. So I called the exchange, the broker hotline. I was like, we're going to need a ticket, right? Because I can't even complete the application
Yeah.
with that piece of information. We were able to open up a ticket, and it took us a minute. We had to jump through some hoops, but at the end of the day, the exchange was able to facilitate getting her, and they backdated the enrollment, right? And then furthermore, because of the magic of the tax credit, um, her health insurance premium went up by like $12. So really worked out well, and that's one of the reasons why I like working with the exchange, because there's real people there, right? You guys have real people, not just some faceless government agency that doesn't care if it's day 61 or so.
Sure. We have
From your guys' side, I mean, how do you see the communication from the broker? Typically a positive for you guys, or?
Yeah, I would say for me on like the communication side of things, we've worked less with the brokers, but we're really trying to incorporate you guys now into our social media and into our newsletter, things like that. We started a lot in Vegas, so I will be reaching out to you soon to do some content with me. But trying to get you guys more incorporated in our day to day. But to your point of just bringing faces to
So
what we're
you're going to
talking
put me
about.
on your camera next.
Yeah, no,
Okay.
we have
All right.
to.
That's cool. That's
like a TikTok trend or something. It'll be fun.
Yeah.
So for me, it's really I'm starting to dip my toes more into that and kind of working with you guys. We've done, blogs and stuff in the past.
Right.
But doing that. But as far as like our call center and our QA team, I know it's constant. Like our QA manager right now just had a baby and she had brokers sending her cards and gifts and things. So it's really just very close knit, and the brokers are part of the team. You guys are the exchange, just like we are the exchange. Like we're a really small agency. We only have 27 full-time employees, only 25 in Carson. So we're very small. Like we need you guys. A lot of the work they do, you're our boots on the ground, our face to face with our Nevadans, and working with us. So I hear so many stories of brokers calling or having this, just like your client who's a day over, just things like that. Hey, I need your help. And our QA team is amazing and gets it done, gets it solved, and kind of always is looking at the best interest of our Nevadans, just like you guys.
Yeah. So that's kind of like the fun part of what we do and whatnot. But we do actually have some big news coming up for this coming year. And what I wanted to do is I wanted to talk to Katie a little bit and help mitigate some of the concerns around the changes that are happening. One of the biggest ones that's going to affect a lot of my clients is there was an affordability metric where, especially for our older members, the pre-seniors, so like 55 to 65, they were able to get tax credits even when their income exceeded the basic parameters of that, the 400% of the federal poverty level. They're still able to get some tax credits because plans can get really unaffordable at that level. And we're going to see a sunsetting of that coming this year. And it's going to be a challenge for myself and my clients. How are we going to move you into a more affordable plan? But it's also a huge challenge for the exchange. And I think that the exchange is going to have maybe not necessarily some options, but some help for those people. And I want you to talk a little bit about what you guys are looking at moving forward to make sure that these folks get some sort of answer.
Yeah,
to what they're doing.
absolutely. So like you said, they had an enhanced premium tax credit during the pandemic. So it started in 2021 with the American Rescue Plan Act, and then it was extended by the IRA, the Inflation Reduction Act, I think in 2023. So we're looking at about 4 to 5 years now of these expanded subsidies. So a lot of people that are on the exchange right now, this is all they've known. They were not here previously. This
Right.
is, the costs they're used to. So cost is going to go up for a majority of our clients. We still, like we talked about, we have a lot of carriers, we have a lot of plan options. So maybe right now you're in a silver plan, but you can save some money by maybe reducing it for the bronze if you do need to look at that, the budget in there, and you're still getting those 10 essential health benefits. You're still getting a lot of that great coverage. So again, work with your broker, talk about what other options are available for you. We also have new coming this year is a public option, unlike some other states. So This has a premium reduction target and a reassurance program. This is the first year it's happening. So it's, we aim to get better over the years and kind of keep reducing those premiums for our Nevadans. So we're trying to help mitigate the loss of these enhanced subsidies for our consumers and really exploring options to maintain our coverage levels. These plans are going to be released. All of our plans with our new rates is going to be October 1st. So you can start working with your broker October 1st to see what your plan's going to look like, see how much it's going to go up, see if there's a better option for you. So even if you're auto re-enrolled, look at the other plan options and make sure this is still the best option for you.
Yeah, for sure. I think one of the things that I would like to get out there is if you are if Aware Benefits is not your brokerage, if you work with a different broker, a different agency, make sure that you set up a time to review. The reason I carved ourselves out, and most brokers I think do this, but we set aside review time during open enrollment for all of our clients. We send out multiple notifications. Hey, nothing else. Let's pull up your account once this year before you're just auto re-enrolled, right? Let's make sure that you're not moving into something that's not so good. And as far as the public option plans go, none of us really know what that's going to look like. So your brokers for sure will be learning as we go.
Big thing, but we still have all our standard QHPs as well, our qualified health plans. So even with these new things, maybe it'll be a great new option. Maybe it's not for you. So again, it depends. Everyone has their own very unique life and their situation and what they need. So it might be great for someone and someone else another plan. That's why, working with you and making that appointment. And even if you love your health plan right now, like you said, let's do a review. Let's take a look at it for the year. This is, one time a year. We only have November 1st, January 15th to change that plan if you do want to change it. So go in, just take a look, make sure it's still working.
And I don't want to put you on the spot, but do you know if we're extending to January 15th this
year? Yes. Next year, no.
Oh, good.
So we had the final rule was released. So we do have some changes coming up. This year, no changes our enrollment dates. We're going to have our normal open enrollment, thank goodness, November 1st to January 15th. Next year, no marketplace can have longer than a 9-week enrollment period. So for plan year 27, our enrollment period will be January 1st through December 31st. Yeah.
All right. I think that's really kind of what we wanted to talk about. We only needed 15, 20 minutes to really chat, but is there other stuff that you needed to bring up or wanted to talk about, or Nevada Health Link doing any really cool enrollment parties? I know that every year they used to do enrollment functions.
We are doing that. Did you go last year? The prep rally?
No.
God, our grantee's not even going.
No, I did. Last year I did. Last year I did. It was the year before that I didn't. So
okay.
Well, it's a crazy time for me too, because we also do Medicare.
Okay.
And so right now I'm in the heart of what I like to call certification season, right? Like I take a test a day for the next 25 days. Certifying for whatever.
Right.
And then every single insurance company is putting together a prep rally.
Yeah.
Health Link does a prep rally. And so
do you prefer evening or during the day if you had a preference?
I prefer during the day because I want to be at home.
Yeah.
I'm a total homebody. Like I leave.
Fair enough. But Nevada, we will be having a prep rally again this year, usually mid-October. And we have all of our community partners and brokers and navigators come attend. We talk about what's coming up for this plan year, other plan year, the coming up, all the final rule and the big, beautiful bill, the impacts those are going to have on the exchange. We're still a little bit of time out for most of those. They're kind of not too many changes this year. Like we were talking about earlier, DACA is no longer going to be eligible for the exchange. That's kind of the biggest thing happening this plan year, and then everything else is going to be in the next couple years. So make sure to keep everybody updated. We're looking at planning some town halls, some virtual town halls that I want to start recruiting our brokers for.
Okay.
So basically it's going to be to answer questions, and then it'll just be like a Zoom and maybe have like breakout rooms. So if someone wants to talk to you one-on-one, we can make an appointment right there or send you over to kind of help them. But really exploring those options in the next couple of months, just because there is so many changes and we want to make sure that everyone is aware. And like we talked about earlier, it's not kind of panicking. And, we're
Yeah.
still here. We're staying the course. If you don't know, please ask, call one of our brokers, call us, call Aaron, and we will tell you what's actually going on. If we don't know the answer, we will find the answer.
Yeah.
There's a lot of headlines and clickbait stuff constantly happening right now. That makes it all seem a lot scarier than it actually is. So
Yeah, for sure. And I mean, I think that's the primary difference is when you find somebody who works in the field all day, every day, like you guys or like your broker community, we're going to stay away from those headlines. We're going to find real information for you and real answers for you. So I think that's important. I think the town halls sound like a great idea. Definitely like that format, because you never really know what questions somebody actually has if you're answering them. So that would be fun. I know that in the past, and you guys haven't been able to do it for a while, but you used to do enrollment events on the first day and then sometime in the middle. I don't know.
Want to bring those back.
Yeah.
So actually that's been on my list. So I went to a conference recently with other state-based exchanges, and New Mexico is doing that. And they had this really great stories of a guy was like about to go hunting, and he's like, I need to get enrolled for health insurance real quick. And he did their virtual enrollment event, and they put him out with a broker, and he got enrolled right there for his trip. Like, I want to bring that back. So I'm actually researching, I think what happened a few years ago was like a lot of privacy concerns and things like that. So I'm just kind of researching right now of how we can bring those back. There's a lot of other states doing that successfully. So I want to bring that back. So I do have a goal to bring that back this year.
Okay.
Because I think it's great. Just kind of being like where you're at, or I can just jump on the phone and, do this real quick.
Yeah, I think that the best one for me, at one time they did it at the convention center.
Okay.
Which might have been before you came on board.
Yeah, it was.
It was still the marketplace at that time. They didn't have they hadn't moved to the exchange-based system or moved to the exchange-based system.
Okay.
Better way to put it. And that was nice just because it did allow us to spread out far enough that I could have
set
a
up like
conversation.
temporary
with
walls and stuff? Is that how they know?
Nothing
Okay.
like that. But the tables were far enough away that I could have a conversation with you without it being broadcast.
Right.
But I thought those events were really great, because the other thing that it allowed for us to do, and Northern Nevada is great when it comes to this, but the broker community here is really collaborative. I know that in some other places, mostly in larger cities, it's much more competitive.
Yeah.
But when we're in that whole room together, one of us would come up with a challenge, and when you were on the marketplace, it was that we didn't have help.
Yeah.
Right, like we do now. We didn't have a broker hotline. We weren't able to
Right.
just go, okay, let me just call
Kind
you.
of just you guys. Yeah.
So I think that made it great, and it did, like you said, it gave people an opportunity to get this taken care of right there. So
I would love to pick your brain on that, because it was prior to my time, and I would really like to bring those back. I've heard a lot of other successful stories of that is happening throughout different
Yeah.
states, so I'd like to bring them back.
So, and I don't know. I think it's can be a relatively expensive proposition.
Yeah.
Mostly just in marketing it, but no, I think maybe get some of the grantees together.
Yeah.
Tell them they got to pony up.
I like that. We're not doing a press conference this year because it just falls on like a Saturday. So we're kind of doing a virtual thing. So maybe we can kind of transfer some of those usual funds for our press conference over into something like that.
Yeah.
And have an event maybe the first week of open enrollment. I really like that, actually.
Yeah, I think that would be a fun idea.
Yeah.
So,
No,
all right.
great
Well,
idea.
Katie, I really appreciate you coming down and spending a little bit of time with us and getting a little bit of information out there.
Thank you.
So, and we'll just keep trying to spread the word.
Yeah.
For sure.
Yeah.
And
Thank
you
you
for
so
my
much.
shirts. I got a shirt.
It's a good shirt. They're popular.
Yeah. I got a shirt, Marcello. Don't be jealous.
Yeah.
Look at that.
Look at that. We have boots. We hit all the things. Got our logo and some boots. Yeah, mine too. You didn't get the color one though.
No,
Yeah.
it's all right. All right. Well, thank you very much, Katie.
Thank
I
you.
appreciate your time.
Okay.